Hey guys, welcome back to RX Pharma Chat. Today we will discuss about the disorders of the blood. Disorders of the blood are either threefold. First one is disorders of the red blood cells, disorders of the white blood cells, and the disorders of the platelets. Now, firstly, we will talk about the disorders of the red blood cells. Now, the disorders of the red blood cells may occur in the form of either anemia or polycythemia. It means when the red blood cells count are decreased or increased in the numbers, then that conditions are called the anemia or polycythemia. Now, what is anemia? It is a disease, it is a condition which occurs due to two conditions. First one is deficiency in the number of red blood cells, and second one is deficiency of the hemoglobin. Because of any one of these deficiencies, there is a decrease in oxygen carrying capacity of the blood. Now, what are the symptoms of anemia? Breathlessness, that is shortness of breath, tiredness during exercise, during working, patient is feel very tired, loss of appetite, and the pallor of the skin, that is change the color of the skin. The important types of the anemia. Now we will talk about the types of anemia. First one is iron deficiency anemia, megaloblastic anemia, hemolytic anemia, and the aplastic anemia. So guys, first one is iron deficiency anemia. In this type of anemia, there is a deficiency of iron due to low dietary intake, and second one is decreased absorption. So guys, due to lack of iron, sufficient hemoglobin is not synthesized in our body. So the defect in this type of anemia, inadequate hemoglobin synthesized in our body. Second one is megaloblastic anemia. In this type of anemia, there is a deficiency of the vitamin B12 or folic acid. We know very well that the vitamin B12 or folic acid are very necessary for the maturation of the red blood cells. But in these deficiencies, either of them, the maturation of the red blood cells are not occur in body. So immature large side red blood cells called megaloblasts are released in the blood circulation into the body. So guys, now pernaceous anemia. What is the pernaceous anemia? It is the megaloblastic anemia occurring due to deficiency of only vitamin B12. So guys, third one is hemolytic anemia. What is the hemolytic anemia? It occurs due to increased destruction of the red blood cells. When the destruction of the red blood cells are very high, are very increased, then that condition is called the hemolytic anemia. It occurs due to hereditary disorders and the mechanical injury to red blood cells and infections like malaria. Last one is aplastic anemia. It occurs due to suppression of the bone marrow functions. It can be caused by the drugs, chemicals, irradiations, and the malignant disease like cancer disease. So guys, now we will discuss about the polycythemia, that is increased in the number of red blood cells count. It is the condition when there is abnormal increase in the number of red blood cells into the body. This increases the viscosity of the blood and the decrease of the rate of the flow of the blood and increase the risk of intravascular clotting. So guys, this is the video about the red blood cells. Thank you for watching my video and see you in next video as soon as possible. Thank you. Have a nice day.